The Spanish flu 1918 before and after. The Spanish flu, also known as the 1918 influenza pandemic, was one of the deadliest global pandemics in human history. It infected approximately one-third of the world's population and claimed the lives of tens of millions of people. We will delve into the origins, impact, and aftermath of the Spanish flu, including its before and after effects on society, healthcare, and public health. 1. Introduction. The Spanish flu pandemic was caused by the H1N1 influenza A virus, and it first emerged in early 1918. It spread rapidly across the globe, affecting nearly every corner of the world. The name, Spanish flu, is somewhat misleading, as the disease did not originate in Spain, but it was one of the few countries that openly reported on its outbreak due to its neutral stance during World War I. 1. Before the Spanish flu. Before the Spanish flu pandemic, the world was grappling with the challenges of the Great War, World War I, which lasted from 1914 to 1918. The war had already taken a toll on human lives, causing widespread devastation and disrupting social and economic structures. The crowded conditions in military camps and trenches during the war provided fertile grounds for the spread of infectious diseases, creating the perfect breeding ground for the influenza virus to mutate and spread. 1. The outbreak of the Spanish flu. The first wave of the Spanish flu appeared in the spring of 1918, relatively mild compared to later waves. However, a second, more virulent wave struck in the fall of 1918, and it was this second wave that caused the majority of deaths. The virus attacked people of all ages, with young, healthy adults being particularly vulnerable, a stark contrast to typical flu patterns where the very young and elderly are most affected. 1. Symptoms and spread. The symptoms of the Spanish flu were severe and included high fever, chills, body aches, fatigue, and respiratory issues. In some cases, patients would turn blue due to a lack of oxygen, a condition known as cyanosis. The virus was highly contagious, spreading through respiratory droplets and contact with infected individuals or contaminated surfaces. 1. Global impact. The global impact of the Spanish flu was unprecedented. It overwhelmed healthcare systems and led to severe shortages of medical personnel, hospital beds, and medical supplies. Mass graves were dug to bury the dead, and funeral homes were overwhelmed. The economy suffered due to decreased productivity caused by illness and deaths, leading to significant disruptions in trade and production. 1. Government responses. Governments around the world implemented various measures to contain the spread of the virus. Some cities enforced quarantines, closed schools, and prohibited public gatherings, while others imposed face mask mandates. However, the effectiveness of these measures varied, and in some cases, public health measures were politicized, leading to inconsistent and ineffective responses. 1. Aftermath of the Spanish flu. Once the pandemic began to subside, societies faced the daunting task of rebuilding. The immense loss of life left countless families devastated and communities struggling to cope. The world witnessed a sudden increase in orphaned children, widows, and widowers. 1. Impact on healthcare and public health. The Spanish flu pandemic led to significant advancements in medical and public health research. Scientists and healthcare professionals worked tirelessly to understand the virus and develop vaccines and treatments. This experience highlighted the importance of global cooperation in tackling infectious diseases and paved the way for international health organizations like the World Health Organization, WHO. 1. Societal changes. The Spanish flu pandemic also brought about changes in societal norms and behaviors. The fear of contagion led to increased hygiene practices, such as hand washing and respiratory etiquette. Additionally, some countries re-evaluated their healthcare infrastructure and established better-equipped health systems to handle future outbreaks. 1. Legacy and lessons learned. The Spanish flu pandemic left a lasting legacy on public health, influencing how the world responds to subsequent pandemics and health emergencies. Governments and health authorities learned the importance of transparency, information sharing, and global collaboration in combating infectious diseases. 1. Modern preparedness. The Spanish flu pandemic prompted countries to establish and strengthen their public health infrastructure. Today, many nations have pandemic preparedness plans in place, including stockpiles of antiviral medications, personal protective equipment, and strategic vaccine distribution strategies. 1. Conclusion. The Spanish flu was a devastating global event that had far-reaching consequences on society, healthcare, and public health. Its effects were felt long after the virus itself had subsided. The pandemic highlighted the need for international cooperation, strong public health measures, and investment in medical research to combat future health crises effectively. The lessons learned from the Spanish flu continue to shape our approach to addressing infectious diseases in the modern world. Thanks for watching.